Welcome to our COVID Conversations, part number 2 with the Illinois Black Caucus members. Tonight, I'm super excited to have Senator Christopher Belt from downstate, Representative Latoya Greenwood from downstate, Representative Debbie Meyers-Martin from the south suburbs, and Representative Maurice West from the Rockford area. And tonight we're going to have some engaging conversation around COVID-19, and we're looking forward to you sharing. I would ask for you to start adding your questions in the chat. The chat is at the bottom of the screen. Just click that and you can put your chats. Our comms team will get those questions out, and our representatives are excited to be here with you tonight. I am, next slide real quick. We're Faith in Place and Faith in Place Action Fund. Faith in Place empowers Illinois people of all faiths to be leaders in caring for the earth, providing resources to educate, connect, as well as advocate for healthier communities. We strongly, strongly believe that when people of faith lead the environmental movement, it's a movement that's focused on justice and care for our common environment. Ways that you can follow us, there's a link there on the screen. You can always go to our Facebook pages, because we have a Facebook for Faith in Place as well as Faith in Place Action Fund. I am Pastor Scott Onque, the very proud pastor of St. Luke Missionary Baptist Church, a 102-year church, old church in the southeast part of Chicago, in South Shore. And also I'm the policy director for Faith in Place. And the representatives and the senator are just some of the hardworking people that we have representing us in Illinois. And again, I am so pleased and overwhelmed that they're here to join us tonight. And so we're going to get started with introductions. We're going to ask for Representative Debbie Meyers-Martin from the 38th District to first introduce herself and with some opening comments to her constituents.
Well, thank you so much, Pastor Scott. I'm very happy to be participating tonight. I represent the 38th District in the south suburbs, so that's 15 municipalities south of Chicago, approximately about 24 miles south of Chicago. I cover Harvey and Markham and Hazelcrest and Country Club Hills and Oak Forest and Tinley Park and Frankfort and Mokina, Olympia Fields, Park Forest, Matheson, Richton Park, Homewood, Flossmoor, University Park. So I'm very happy to be here. I just want to let my constituents know that my office has been open every day since the stay-at-home order was put in place because we wanted to be available and accessible to all of the residents in case there were issues that we needed to address on the state level. I'm happy to say that we have been interceding for people who have lost their jobs, who have been trying to access IDES. We've been helping people receive masks and personal protection equipment. So I'm just very happy to be a public servant in the south suburbs. I'm a former mayor of Olympia Fields, and I desperately want to be that strong voice in Springfield that helps move our region forward, whether it be economic development, healthcare, all of the things that make the quality of life what we deserve and certainly what we want. Thank you.
Thank you so much for that great introduction. And now we're going to have Representative Maurice West, number 2, from the 67th District out of the Rockford, Illinois area. He's going to introduce himself and let you know what he's doing there.
All right. Well, Pastor Scott, I appreciate you for this opportunity. Thank you so much for bringing me on. To my colleagues, well, minus Latoya, so good to see your face. Latoya, I guess I'll have to wait till next week to see you. As they say in Game of Thrones, I deliver the North. I'm from Northern Illinois, and I'm in Rockford. It's a city that I grew up in, a city that I love. The 67th District encompasses primarily Rockford. I have 2 or 3 streets in Loves Park and a couple of streets literally in Cherry Valley, Illinois. So I have 53% of Rockford, and this is my passion of being here for my Rockford residents. This is my first term. I've been in the political arena for 6 years. I lost a couple times before getting this one, but losing makes you stronger in terms, I say, and it all happened for a reason. And so now I have the opportunity to serve my constituents. And like I said, I'm grateful for that. I've been doing a lot of my work from home, as my constituents know. I am blessed to say that my wife and I are expecting a baby girl in September. And so, thank you. And
Congratulations.
I appreciate it. During this time, though, I'm really confident that my constituents will understand that takes precedence, and they will understand that I stay home to risk the exposure. And now I wait till no one's in the area to come into the office, and I sanitize. But the constituental service is still the number one goal for my office. I've been able to help a lot of people via social media. We check our phones every day, and we are getting back to them within the day's time. And so I'm thankful for the staff that I have, and for the constituents that I have. I want them to know that they could always reach out. I'm looking forward to this conversation with my colleagues and Pastor Scott and everyone else who's part of this the Faith in Place Coalition. Thanks again for this opportunity.
Great job. Thank you. And now we're going to have our Representative Latoya Greenwood down in the East St. Louis area, the 14th District. You can't see her face, but you can definitely hear her voice. Representative Greenwood, would you go ahead and introduce yourself and talk about your district?
Yes, thank you so much, Pastor, again, for putting on this forum, this space for us to be able to communicate to our constituents and people all over Illinois as to what we're doing. I represent the mighty 114th District, is what I like to call it, yes. And it includes East St. Louis and Centerville, Allerton, Washington Park, Cahokia, Belleville, O'Fallon, Millstadt, Mascoutah, Freeburg, Smithton, Lebanon, and Scott Air Force Base. And so I have been honored to serve the 114th District as their state representative. This is my second term. And the things that we are doing in terms of COVID, my office has been operating remotely, virtual, like a virtual office. And so we still continue to check our voicemails every day, responding to emails every day, dealing with constituents' concerns that range from unemployment to teenagers trying to get their driver's license to joblessness to issues with homelessness. So there's a varied issues that we're still trying to address, including testing, which we've been able to work with the senator and myself in getting testing sites here in East St. Louis, working with the governor. So we're very excited about that. And so I look forward to hearing the questions and being a part of this conversation this evening. And again, thank you for having me.
Great job. Thank you. And now our Senator, Senator Christopher Belt, out of the 57th District, downstate in the East St. Louis area. And we're going to have him come on and introduce himself and talk a little about what he's doing there in the great District of 57.
Hey, to all my colleagues, to you, Pastor Scott, thank you for this forum. Again, I am State Senator Chris Belt from the 57th District. The 57th District encompasses most of St. Clair County and parts of Madison County. State Representative Latoya Greenwood is one of my state representatives. So all the cities that she named also fall under my jurisdiction as well. Leader Jay Hoffman, Representative Hoffman, is my other representative. And so I share districts with him as well. just really happy to be here, really happy to have this conversation. You know, this pandemic has shaken a lot of us to our core, but we made a valiant fight. We've been fighting for our constituents, whether it's, as Representative Greenwood said, whether it's emails, phone calls. Likewise, my office, physically, I'm not in the office, but we have virtual office. Emails are checked daily. Voicemails are checked. And so we're fighting the good fights, trying to make sure that we have testing for our constituents, that we make sure that they can get their unemployment, make sure that they are up to date on the latest and the greatest executive orders as the information is so fluid and it comes out so quickly. We do our best to disseminate that information to the residents of the 57th. And so just really here and happy to have this conversation tonight. So thank you.
Great, thank you. Great introduction, wonderful. So before we get started, just as a reminder, in the chat box, you can find some information. You can put your questions there. But also, if you want the conversation to continue, we would encourage you to click on the link where it says faithinplaceaction.org, get involved, action alerts, so that you can continue to get information from Faith in Place Action Fund, as well as stay informed. And so the outline, and is a very informal outline tonight, because we want to have a conversation, but we really want to talk about some of the things that the districts are doing around COVID-19 and your immediate responses. Some of you have mentioned some of the things, but if you can talk about some specific things that your district has done or your office has done in response to COVID-19. And we're going to again start with Representative Debbie Meyers-Martin. If you can tell us some of the things your office has been doing around COVID-19 in response to the pandemic.
Thank you. Well, we have been very involved with the mayors. Many of the mayors have had distributions of food and personal protection equipment like facial masks and gloves and hand sanitizers. And so I have been supportive of those efforts and tried to participate along with them because once the governor actually put in an executive order that required facial masks for everyone over the age of 2 who could not social distance, we wanted to make sure that our constituents had masks. The other thing that I have been trying to do is to connect constituents with the services that they need, whether that be utilities and finding out about the programs that are being offered by NICOR and People's Gas or ComEd. I wanted to make sure that people were aware of those resources that are available. I wanted to make sure that they were able to connect because so many people complained about trying to get on and file with IDES. So I have been trying to connect people to the agency itself, and as we've heard over and over again, it was overwhelmed by the number of calls from people who have lost their jobs. And so I have been trying to do that. So in my effort, I think information is so important for people to know where to go, who to call, how to get and affect the resources that they need. And so that, I have to say, has been my main focus, and also just addressing the questions that have come into my office. Because this is an unprecedented time that no one has witnessed before in their lifetimes.
Absolutely, you're right. Representative West, what have you been doing there in your district?
Good question. I don't know if I would say I'm unique in terms of, and fortunate. I have one mayor that I really work and partner with in terms of ensuring that resources are brought to the city, and he's doing a phenomenal job in keeping us informed. As I mentioned earlier, I found out shortly before we left Springfield that we were expecting And so under wife's orders, I was told to do as much as I can from home. And so what I did was I developed a platform on my Facebook, Community Connections, where 3 times a week I'm doing Facebook Lives, bringing people within the Rockford community on my Facebook Lives to talk about the resources that they have during this pandemic. I brought forth like ComEd, NICOR. We talked about the information about and the resources that they have. I even brought in my Congresswoman, Sherry Bustos, to talk about the CARES Act at the time that it came out. Just this morning, I brought in the Citizens Utility Board. I'm bringing next week the Pork and Beef and Dairy Association, Farmers Associations, so that my urban residents will know what is going on with our farmers and can appreciate and sympathize with them on their struggles as well. And all that focuses around unifying my area. I don't mind saying it publicly. I'm in the 67th, and in the 68th is my colleague who sued the governor and is bringing polarizing and divisiveness into this time. And I have others in the area who's doing the same. And so I made at a point to make sure I'm finding ways to unify the district, working with people and community organizations who are going out to provide food to our youth and to our senior citizens. And since I'm under orders to stay home for the sake of my family's health, I'm sending my contributions, financial contributions from my political funds to help community organizations to do the job that they need to do to help to unify our community. So it's all about unification. And of course, as always, it's also about constituental service, answering the phones and having conversations with constituents. A lot of the conversations have been focused around IDES, and I'm most likely, I see a lot of nods. So we all have the same kind of issues, and some of it could be frustrating. I want to give an answer, and at the same time, I have to wait till things happen on the department side. And but it's all about at least having a unifying attitude and not trying to stay on one accord on one message. That's what I've been working on here, because throughout our state, there's several messages going around, and the question becomes, who do you believe? Whose report do you believe?
Right. Great job.
I want to make sure we have one report.
Wonderful. Representative Greenwood, I know that you and your senator work hand in hand together. So you two can feel free to jump in and piggyback on each other. I love how you guys work, which is great. That's a great testament of a good working relationship with a senator and a representative. So you can start the Representative Greenwood on some of the things you're doing, and then Senator Bell, if you want to chime in on top of her, feel free. But I know you guys are doing great work downstate.
Thank you.
Thank you. So like both of my colleagues have stated previously, for us, it's about information and resources, making sure our constituents have the information that they need and the resources that they need to really go forth in this pandemic. Like I stated previously, we were able to get 2 testing sites here in East St. Louis. And with that, we partner with the governor's office on both of those. We've been in conversations with our local mayors and our county chairman as far as always staying on top of information again. And coming up, we'll be participating or having a mass giveaway in various parts of our district that we share together. And I'll turn it over to Senator Bell.
To piggyback and off what my representative has stated, yeah, we've wanted to make sure that we got testing sites in all of our districts. That's important. But we also wanted to make sure that we got our testing sites into African-American communities, because we know the comorbidity rates, the underlying issues there, and the fact that African-American seems to be, it almost seems to be a death sentence for African-Americans when they get infected with the virus. And so we worked diligently and collaboratively with the governor. We were able to get 2 sites in East St. Louis. One is an IEMA site, which is, I think it's only 6 of those in the state. So we're really, really blessed to have that. It's at the Jackie Joyner Kersey Center. And I toured that facility today, and they're doing outstanding jobs. It's manned by the National Guard, and so they're doing a wonderful job. We also have one in Cahokia. We have one in Belleville, and so we have them all in our district. And so we really wanted to make sure that we got the facilities. Now, once you get the facilities, you have to get the word out to the residents that the facilities are here, they're open. And as this thing changes, like I stated before, it's so fluid that we want them to know that you don't need a doctor's referral. We want them to know that there are no out-of-cost pocket expenses. If you have insurance, they'll take it. If you don't, they will not turn you away. For our essential workers, we want you to know you can come, and you can come now anyway without any symptoms. We just ask that you call a screening number. And so I often say knowledge is power. We have to get the word out. And so that's what me and the representative are doing. We're really, really happy. We have bulk masks coming, and we're going to hit our district and get those masks out to people who need them really, really bad. And again, after May 1st, it's the governor's edict that you have to have a mask on. So we want to make sure that we get that done.
Great.
And just ensuring that we are able to, like Representative Myers stated, make those critical connections that our constituents need. You know, a lot of times they just don't know where to turn to, which department to go to. So our role is very critical during this pandemic in making sure that we are able to make those connections for them.
Wonderful. One of our listeners, Marianne Bitos or Bitos, put a message in the chat. She says, does anyone have information about the children that are being held in detention centers who were taken from their parents at the border? And I don't, this seems like a congressional question, but does anybody have any information about that?
I do not.
Okay. And then the other question, which is probably closer to home, about mental, how are the communities dealing with the homeless persons who lives with a mental illness, or are there resources for them? Have y'all been hearing anything about mental health resources in your districts?
Well, I would have to say that for mental health issues, certainly my office would direct persons to a couple of agencies, in particular the Department of Human Services, but also other healthcare facilities, because that is a very serious issue, but also one that is becoming more and more prevalent just because of our condition that we find ourselves in, stay at home. And so I certainly hope that anyone who is seeking that type of help could reach out to my office, and I would be happy to put them in touch with some of the agencies that I know are working with individuals that are experiencing that.
Great.
Absolutely.
Thank you. Representative West, I'm going to put this question to you because someone just asked the question. I've heard the complaint that closing churches is a violation of religious freedom, and rights under the Constitution. How are each of the representatives and the senators dealing with concerns for churches in their areas? And you being a preacher in your, how are the church community handling the stay-at-home order from the governor?
It all depends on which church you ask. If you ask the Black church, we're staying at home. If you go to a bigger white church, you're seeing that they are being, they're having their times of complaints and wanting to open back up. And I hate to say that, but just based on what I'm seeing, that's what it comes down to. I have had conversations with religious leaders up here, and I said, as a community leader and as a faith leader, the last thing we want to do is bring a reproach to the God we serve by letting the Illinois Department of Public Health find out that coronavirus was spread at a church service. And all it does is it doesn't help the witness of whatever God you serve. It doesn't help the witness that you're trying to profess. And so it's so important that, yes, we have faith, but we have to be cautious. A lot of our church members happen to be those of the vulnerable community. A lot of the faithful ones happen to be over 60. Mm-hmm. And so a lot of pastors are finding themselves really needing to make sure that they do what's best for the few so that they can be beneficial and influential in terms of their ministry for the many. But on the same token, a lot of churches are doing Zoom meetings and it's going great. My church, we went from 3 people coming to prayer to 30 people on prayer and Zoom. So we're doing great on terms of membership, but it all comes down to, it's church by church. It comes down to the church that you really want to talk about.
Right.
Yeah.
Senator Bell, downstate, are you hearing any complaints from the clergy and the churches down there about not being able to open?
You know what? In my district, we have the churches have been very compliant. They've worked with us in terms of congregation, Sunday morning worship or Saturday worship or what have you. In terms of funerals, we've observed the 10 people, including the pastor or the bishop, being counted in that number, and everything has been done virtual. You know, it's been really, really easy. And don't get me wrong, they're chomping at the bits to get back, but they have worked with us, and they've done a yeoman's job of working with us, adhering to the CDC guidelines, the governor's EO, and so we've had it pretty good in my district. Rep. Greenwood, wouldn't you say?
Yes, I agree with that.
Okay, great. Nicole Salisbury asked a question about protections for DCFS children, workers, actually, the Children Protective Service workers, as they make home visits. Has anybody had any complaints from DCFS workers about them being at risk for going into home visits?
I have not had any workers reach out to my office. Now, as part of these working groups that has been established to deal with COVID, I've heard about some issues with the PPEs for workers, but I haven't had any contact my office directly.
Okay, great. Well, let's get to the controversial part. How do y'all feel about the? Was it a surprise to you when you started seeing the numbers on how COVID-19 actually affected the African American and people of color at a great disparity compared to other demographics? And I'm gonna let Representative Debbie Meyers-Martin, you start, because I don't know how you feel about the suburbs, but were you surprised, not surprised? How do you feel about that?
Well, I am so glad that you asked that question, because the South suburbs in particular and the African American community have been very hard hit by this pandemic. As of May 7th, there were over 383 deaths in South Suburban Cook. There was a jump of over 160 deaths in 1 week. I'm sorry, it jumped from 47 to 160 deaths in 1 week. So as many have said, this pandemic has really illustrated the disparities in healthcare in the African American community in particular, but in the Black and Brown community. So my answer to that is that once we are back in Springfield, which you probably know will be next week, we are certainly going to have to roll up our sleeves and begin to address these healthcare disparities, whether that's working with hospitals, working with healthcare agencies. But it was very surprising to me, but now that we have gotten the information that we have, it's just something that we now know we have to move forward in addressing them. The time for conversation is over, and it's time for action at this point.
Great, yes. Look, Representative Greenwood?
Yes.
What's happening downstate? Are you seeing the same disparities that we're seeing in the city of Chicago?
Yes, the same disparities. And I would have to say that I was not shocked when the numbers started to come out. COVID has laid bare the inequities that many of the legislators that's on this call right now have been addressing for quite some time now. We have talked about the inequity in healthcare, access to healthcare. We've talked about inequity in education. We've talked about the issue with jobs and trainings in our communities. And so COVID has highlighted to many others who didn't know what we were facing in our communities on a daily basis. And so I agree with Representative Meyers-Martin that now is the time for action, and now is the time to be, we have to think outside the box in how we plan on addressing these issues that are killing Black people in Illinois, Black and Brown people across the state.
Wonderful. Senator, what do you have to say about that?
Well, I agree. I agree with the total sentiments of my colleagues. What COVID did do is expose what we've known all along, that those comorbidity rates in our community, whether it's diabetes, whether it's hypertension, whether it's sickle cells, lupus, that they've always been there. And what makes this virus is so dangerous for people, African American people, is that once it seeks us out and once it infects us, then it preys on that underlying physical issue that we have. And to a person, me and the representative, we know people who have both went into the hospital suffering from this COVID, and it's been killing them left and right. And so my plea is, we know what we're up against now. You know, when COVID first came out, I didn't quite understand what it was. But once you start studying and looking at the trends and seeing that it disproportionately impacts African Americans, then we have to stand up and say, we got to do something as well. Now, we are what we are right now. We have the illnesses that we have. I suffer from hypertension. But the idea is we have to adhere, right? We have to adhere to those CDC policies, the social distancing. We can no longer throw a barbecue in the front yard, in the backyard. We can't have card games and go live on Facebook with 15, 20 people, because we are carriers, right? My dad's 82 years old, and I don't want him to get it. You know, I mean, I have a compromised immune system. I had a kidney transplant in 2010. So I have to be careful. My dad has to be careful. And so we have to know this as a group of people, that even if we're okay, we could be carriers. And so the onus is on us, as well as others, to really understand what we're up against.
Great, great. Thank you. Representative West, you have a predominantly, is it in Rockford, a predominantly Black or brown community there that you represent?
I have a strong presence in both, but it's still, the white community is still prevalent.
Okay, so how are the numbers up there in Rockford?
Yeah, I don't know if you guys saw it, but the New York Times put out an article about a week or so ago, ranking Rockford 8th in the nation of most likely to have the next potential outbreak. And so we're trying to be very proactive on that. We already are up to 1,700 just in our county. And the surrounding counties around us are in like the low 100 levels. And so we're being very cautious and looking at ways to be proactive and trying to get that number down. And I think this goes back to the question that you talked about in terms of church. Why is there a racial breakdown on how people feel about this? Just because the Black and brown community sees that it's killing us at an alarming rate. I'm seeing 20-year-olds, 30-year-old Black people dying of this, or being really affected by this to like negatively. They may recover, but they lost something in the process. And so it's something that we really need to take into consideration. And I understand wanting to open up the economy ASAP, people not liking the phase in. I've had conversations with people who want to just be transparent with me, and they say, I'm just worried about what I'm going to have for dinner tonight. I'm like, well, I'm worried about my brother and sister down the street who this virus is taking because of our underlying health issues. So it's a conversation we really need to have.
Great, great. Well, let's turn to policy real quick, because you guys are going down to do a great work, and I'm praying for you. I'm praying for you. We know that probably the budget's going to have to come up next week. And we realize that we spent a whole lot of money that we didn't anticipate spending. And so how are you guys going to protect the interests of the things that we know that are most important to the communities that you serve as you continue to move forward with the budget? That includes resources for communities dealing with unemployment, domestic violence, child care issues, hunger, homelessness, the issues that are very prevalent in the communities that we serve. And I'm sorry with you, Senator.
Thank you, Pastor Scott, for that question. It's funny that you brought that up. We're going to, the Senate Black Caucus will have a phone call meeting, a conference tomorrow at 5 o'clock to discuss the budget. And then from whatever we come up with, we'll bring in the House side and see if collaboratively as a joint caucus, we can put a agenda together for the things that we do not want to make sure is cut. And so when you talk about in our community, when you talk about Black community, you talk about trauma, that's really important. We want to make sure that there's mental health, money in the budget for the mental health, trauma. We understand that, since COVID has come along, there's been a spike in domestic violence. We understand that gun purchases have gone through the roof. We understand that there's a deafening quietness to abuse towards kids, because they're not at school anymore. And when you're at school, you're mandated hotline, a reporter. And so what's going on? And so we want to make sure that we have money on the table for that. We want to make sure that we want to protect our workforce diversity, our training dollars, and because there's going to be a time when COVID goes away, and we want to make sure that African Americans get a piece of that pie and that they go back into the workforce. And so all those things, whether it's education, health disparity, some of the things that all my colleagues have spoken about tonight, we're going to put an agenda together tomorrow at 5 p.m. We're going to collaborate with our House colleagues. And then when we go up to Springfield next Wednesday, we understand that there will be some cuts, but we cannot be the ones that suffer the brunt of all the cuts in the deepest cuts. So that's our task.
Wonderful. Representative Debbie Meyers-Martin, how do you plan to address these cuts that we know are very much looming as we go forward to the budget process?
Well, I certainly agree with Senator Belt's take on how we're going to have to proceed working through our Black Caucus. Certainly, there are monies that are going to be available coming to the county and the state from the federal government, and we're going to have to make sure that some of those dollars are directed to some of the programs that will not survive without our help. And we understand that this budget is going to be challenged. All reports are that there are going to be cuts anywhere from 20 to 30% across the board. So we know that it's going to be challenging, but there just has to be determination that some of our most vulnerable populations are going to have to be taken into consideration, and we're going to have to make sure that that money is not left on the table when it comes to those programs and the people that they serve.
Wonderful, great. There's some questions about the PPP funding. Have you found in your districts that the small businesses and the nonprofits, as well as even the churches, have benefited from the PPE funding that was out there, the $310 billion? And then we also, they released the round 2 because we found out round 1 kind of left some people out. Are you hearing anybody having success stories in your districts?
Pastor, I would have to say no. I have not heard any success stories in my district. However, I am working with Seaway Bank, who is going to do approximately 130 loans that for small businesses that did not receive original PPP funding. And so I am working with them and my small businesses in the district to help them access some of those dollars. But unfortunately, I don't think that it was a success story at all in my district. And you hear the horror stories every day about companies that should have received money but did not.
Thank you. Representative West, how about you? Have you?
And companies that should not have received money, receiving money. I'm in the same boat as Representative Meyers-Martin. I think the PPP program, and we had one here in the city as well, locally, but both programs, I think even ours in the state, most likely will have a lottery system on how the people are selected. And just based on what I've seen on people reaching out to me on Facebook saying that I wasn't picked in the lottery for the PPP program, can you help? And I'm like, it's a federal program, and the lottery system is the lottery system, and I'm hoping that it is random, but it just happens. It feels as if sometimes that some of the bigger conglomerates who don't need the money is getting the money in this lottery system. So it makes me wonder what can we do to make sure. Going back to Senator Belt's statement, we have to make sure that there's money out there that is targeted, that you don't have to apply and think about the fact that you may not get it. That's targeted towards businesses that are minority owned, women owned. And so, yeah, I don't have many success stories on my end either.
Good. Representative Greenwood?
I would have to concur with my colleagues. I have not heard of any success stories in my district. And everything that they said about, I love that you're working with banks, Representative Meyers-Martin. They may be something we need to do too on our end. but just to create a space that they feel comfortable in knowing that there was a connection you made. So that is definitely something I'll be looking into here locally to help some of the small businesses. And like Representative West said, you hear about bigger companies and corporations receiving relief and assistance. And then you have our small business owners who are left with nothing. And so that's a problem, and we need to try to make a way to assist them.
Now, inside your chat, Gordon Hellwig has put some information around PPE, and he's inviting you to go to his website for assistance. And so,
Okay.
if you know someone that needs some assistance with getting some processing done, he has a www.iff.org, and I would reach out to him. Okay, so we're going to do a quick poll, real quick. And I'm going to have our comms person help us with this. And the poll that we're questioning is, how do you feel about the governor's phases? The 5 phases that are in progress. And so the poll is up. We ask for you to, if you support the plan and its implementation, or I like the plan, but have some concerns about its rollout, dislike the plan, or am I hopeful it can work, or am I opposed to the plan? We're just taking some polling right now. We're just having a little fun with some polling. Okay. Okay, 45 sec for all right, we are near 8, 7 seconds, 4, 6, 5, 4, 3, 2, 1. And the poll is closed. All right. So 58% of the respondents feel that the plan, they support the plan and its implementation. 37% says, I like the plan, but have some concerns about its rollout. And 5% says they are opposed to the plan altogether. So with those results, let's have some conversation about the governor's 5-phase plan. And 1, how knowledgeable of it are you? And 2, are your constituents in agreement with the poll? And we'll start with you, Representative West, since you're having some controversy up there in the Rockford area.
Yeah, I have, like I said earlier, my colleague is one of the reps who is suing the governor. So I have mixed reviews on it in terms of my constituency. No, in terms of the city, I haven't heard too much pushback of it in my district, even though I know there is some. But I was one of the in the poll, I was the one who said that I like it, but I have concerns. Only because my region, the region I'm in, includes some counties who've had only 12 cases or 18 cases since March, when my county is up to, like I told you, 1,500 cases almost. And so is that fair for those other counties that the peak has long been gone compared to my county? Will we be holding them up to move to the next phase? And so, that's overall, I'm glad that we have a plan.
Good. Okay, great. Representative Greenwood, how do you feel about the plan, or how does your constituents feel about the plan? Is it reflected of the poll?
I've received mixed reviews about the plan, and the Metro East legislators recently sent a letter to the governor with some concerns that we had about the plan. Not that we're going to defy the plan, but just making some suggestions about moving forward here in our region in the Metro East area. So I like the plan, but there are some areas that could be improved upon.
Okay, great, great. Senator?
Likewise, Pastor Scott, we, the Metro East legislators down here, which consist of myself, Representative Greenwood, Representative Hoffman, and then Rochelle Crow, Senator Crow, Representative Bristow, and Representative Stewart. We all put a letter together, and what we asked in the letter was, hey, look, we just think that the rollout could be moved up in our area. So instead of waiting to the end of the month to go to phase 3, we asked that by tomorrow, this Friday, that we can go to phase 3. We think we've hit the benchmarks of the rollout, and we just wanted to more accelerated rollout that acknowledged that where we are in this place and time instead of a one size fit all. So we like the rollout, but we just had some, like Representative Greenwood said, we had some issues concerning the timeline. I don't think our timeline should be the same as Chicago's timeline, which shouldn't be the same as Rockford's timeline. You should always look at the region and let those public health officials in that region dictate the opening. And that's all we were asking in our letter. But we think the governor, we're not trying to be critical of the governor. He's done a yeoman's job in dealing with this pandemic. But that's was our concern. And Pastor Scott, let me just say this has been an outstanding forum. Unfortunately, it's 5:52 and we got to get on another call.
Yeah, we're winding it down right now, actually, okay, because we were ending at 6 o'clock, and so we're going to closing comments. And because we're very conscious of everyone's time, we're scheduled from 5 to 6.
Thank you.
And so if we can go ahead and I'm going to start with you, Representative Myers, if you can do your closing comments and also include how you feel about the plan, and then we'll go to Representative West and then Representative Greenwood, and then we'll let the Senator close us out with your farewell salutations.
Well, let me again say thank you to you for allowing us this opportunity to share updates and information with your audience and with our constituents. As far as the governor's plan, I'm just glad that the governor had a plan. This is something that's very serious, and it needed to take a lot of things into consideration. And so I'm glad that there was a plan. That being said, I've heard from a lot of restaurant owners, restaurant and bar owners, who are concerned about the timelines. And there probably could be reconsideration for those timelines for that particular industry. And so while I'm glad there is a plan, it does need tweaking. And I hope that, the governor going forward will do the tweaking and that we will provide input on that. The other thing that I want to say is thank you to the governor and to my colleagues, my Southland legislators, because we continually lobbied the governor's office for a test site in the south suburbs. And we did receive one in the city of Markham. And I have to say that that is the largest test site in the state. And they are averaging over 900 tests a day, for which we are very grateful because, as we said earlier, we were seeing a higher number of cases in the Southland, and we definitely needed to test because, as you've heard from many experts, testing is the key. I'm happy that I am working with 3 working groups in Springfield: economic recovery, higher education, and local government. So as a former mayor, I'm certainly mindful and thoughtful about how our municipalities will fare during this crisis in terms of funding. There's been a lot of lost revenue. And so we really have to address those things. And I'm happy to be working on those 3 working groups, along with childcare and of course the budget. So there is a lot of work that we must do from now going forward. And I think that we're up to the task as long as there is cooperation and a common goal to move Illinois forward and to come out of this pandemic even better than we were before, because I feel that we've learned a lot of things during this time to reflect as stay at home. And those are things that we must not forget, we must not dismiss, and certainly being the voice and truly the voice of the people that live in our districts is what is important to me, and I'm sure all of my colleagues. So again, thank you for this opportunity. And everyone, please remember my office is open Monday through Friday, and I'm happy and look forward to hearing from you. So thank you.
Let me do this, Senator. I know you got to jump on another call, so go ahead and say your goodbyes. I really appreciate you because I don't want you to be late for your next call.
No,
okay.
I thank you for the forum. Thank you for the opportunity to have this conversation. It was important. It needed to be had. My mom used to say when she was here and on this earth that the prettiest flowers grow after the storm. And so I'll leave with that the idea that we're in this pandemic now and we'll get through it. But understand that there are lessons to be taken away from this, and it's incumbent upon us as legislators, as leaders, as civic leaders, as religious leaders. We have to make sure that we seize the moment. We have to make sure that we identify those areas and that we move together to remedy those things. That, to me, that's the biggest takeaway. And again, Pastor Scott, I thank you for this opportunity, and I thank you for this forum, and I thank you for the opportunity to see my colleagues. Maurice, I haven't seen you, man, since we left.
Good to see
Representative, I see my representative all the time. God bless you all. Thank you.
God bless you. All right. Greenwood, you have to leave also? You have to jump on? Okay,
yes.
Say your farewells, and then I'll let Representative West close us out.
Thank you so much, Pastor, for this space. Thank you to my colleagues. It has been very informative to hear about what we all are doing to help move the state of Illinois forward. I want to remind my constituents as well is that they can still contact my office via phone or contact me via email, and you will receive responses to get the necessary assistance that you need. Also, I just look forward to continuing to be a voice for the people of the 114th district and continuing to move this state forward and highlight and resolve the many issues that this pandemic has uncovered, moving forward with solutions to address those things. Thank you.
Great job. Representative West, close us out, man. Thank you again.
Well, thank you, Pastor. I appreciate you. And to everyone who was here listening to us, thank you so much. To my colleagues, thank you as well. It's so good to see you, and just to hear that we're all, we're on like-minded and on the same page in what we're experiencing. Senator Bell, I love the quote, the best flowers come after the storm. And this is what we're going to experience with this pandemic. That at the end of the day, we're going to come out bigger, faster, and stronger after this in some way, shape, or form. To my constituents, I'm always here for you. I may not know every single one of you, but I love you. And I want you to know that you can reach out to me at assistance@staterepwest.com or 815-987-7433. Thank you so much.
Great, great. Thank you, everybody, for joining us for this hour of very much engaging conversation. I really, really appreciate you. In our chat box, our comms department has listed some links that you can click on for more information. I really encourage you to click on those links so that you can continue to stay in contact with Faith in Place Action Fund and Faith in Place organization. Again, thank you to our representatives. Thank you to our senator. And thank you to everyone that joined us this evening. It has been a tremendous pleasure. And we look forward to continue to do the work. And we're staying on the ground because the work is not yet finished. God bless each and every one of you. Have a good night.